Hi, my name is JONeill. I'm a retired mental health therapist, and I have been looking for quite a while now at the possibility of integrating a dog into a therapeutic setting. I'm no longer working in paid work, but I do have plans on doing some pro bono work in grief counseling in the future. So I'd like to share my journey with you on how I have tried to answer this question: can my pet work with me as a therapy dog? Now, I just want to step back for a minute and just with the observation that when I was growing up, there were really only 3 different categories of dogs. We had pets, of course. We had working dogs, especially out on the farms. And we had service dogs, like guide dogs for the blind. But really, it's just been in the last 30 or 40 years that therapy dogs have kind of emerged and grown in popularity, along with comfort dogs. As we've done more and more research on the human-animal connection, we've realized the benefits of those interactions. For example, just petting a dog increases our oxytocin, the love hormone, and decreasing our blood pressure, making us just generally happier, less depressed. Those therapeutic responses are really important. And as we've started to see this more and more, professionals, psychologists, counselors, social workers, have all started thinking about how they might use canine-assisted therapy in their practices. And that's where I am right now. So there are many considerations in deciding to use a pet for therapy dog work, especially for a professional. I would like to talk about some of the traits of the breed, the dog's individual personality and behaviors, the dog's overall health, work environment, population being served, required tasks, necessary training, and education for the therapist by using me and Neva, my dog, as examples. Now, this is really important because it's been my experience in talking to my colleagues that most therapists who are trying to decide whether or not they would like to work with a dog really don't understand this process. So I'm happy to share that. Okay, so first, the breed. Golden Retrievers. My last dog, Kendall, looked just like this dog. She was a typical Golden Retriever. She had been raised to be a leader dog for the blind, but had some allergies and was career changed, so I put her to work as a therapy dog. Goldens are known for certain traits that make them really good candidates for therapy dog work, especially sociability, patience, and confidence. Neva is my current pet. She is a 3-year-old English cream Golden Retriever. These white Goldens are considered especially chill. She's friendly, outgoing, and playful, and loves being petted. She had a rough start in life. She was born with ectopic ureters and had to have surgery at 5 months old to cure her incontinence. But she is now healthy and happy and ready to get out there. The work that I'd like to be able to do with Neva is at a grief center. I've just applied to be a volunteer at the center. It is a small nonprofit in the Denver area that provides counseling to individuals of all ages, people who have lost loved ones to illnesses, accidents, and suicides. The center has had no prior experience with dog therapy, so it's really important that I get this right if I'm going to introduce therapy into that practice. One of the most important things is education, to educate not just the clients but also the other therapists about the benefits of canine-assisted therapy, and also to get client consent, because as much as we'd like to believe that everyone loves dogs, we know that's not really true. Now, the environment in a grief counseling center is rather subdued, so for this reason, the breed of dog is really, really important, and this is where I think that Neva as a golden retriever would really fit in well. Although she can be really playful, and people, even when they're grieving, need to laugh and smile, Neva also is very chill. She loves being around children, and I know that she would lie quietly while they buried their faces in her fur, and she would jump up and offer a toy if she thought they needed help getting out of that hole. I'd probably be a little bit more concerned with her about working with adults, because adults who are in grief often have a very strong trauma component to their grief, which makes them really freeze up. Now, having a dog by their side is often very, very helpful in helping them to talk and just let go of some of that. But one of my major concerns would be that Neva would absorb too much of this, being that she is a very empathic dog. However, I would just need to keep an eye on her, watch her sleep patterns, her eating patterns, and her reactions to going back to the center over and over again. Hopefully, she'll love it. Now, before Neva and I can even start, I need to do a couple things. First of all, Neva needs to do some therapy dog training because she has to pass her Canine Good Citizen test. And I would like her to actually get introduced to the world of therapy dog work in a more basic therapy dog environment by working with one of the big organizations like TDI or Pet Partners or some other organization in the Denver area where we might enjoy the work that they do. This will give her some experience in this type of social setting before she enters any kind of grief work. Now, Neva's not the only one who needs training. I have to admit that I do as well. So this is something that I am afraid most mental health therapists are not familiar with, the requirements as a therapist of developing the appropriate competencies prior to bringing a dog into the therapeutic setting. So as a mental health counselor and being licensed as a counselor as opposed to a psychologist or a social worker, I need to follow the American Counseling Association Code of Ethics, which says that I have to have a certain degree of competency in any modality that I work with clients. Now, the ACA does not require certification in animal-assisted therapy. However, they do have guidelines that they have put forth in terms of outlining what competencies should be in place according to their code of ethics. So these fall under the general headings of skills, attitudes, and knowledge. Skills are pretty basic. As a licensed therapist, I can say that I have all of the basic skills for counseling and am totally ready to work with clients in any setting. The next category is attitudes, and I feel that after doing this program at University of Denver, I can really attest to the fact that I have developed a really good sense of animal advocacy and everything that goes with it. All right, so the third category is knowledge, and this is what is still lacking. So in order for me to do animal-assisted therapy and counseling, I need to have some formal training. So there are a couple of organizations here in the Denver area that I'm looking at to access that type of training, and I'm really looking forward to doing it. I think it'll be fun. So once Neva and I are both trained and have experience as the therapy dog team, we'll start to work in therapeutic settings, hopefully in a grief center, as I described before, offering this very special service to our clients. I really look forward to working with Neva and becoming a kind of canine-assisted therapy team. Thank you for listening. I hope that you've gleaned just a little bit of knowledge from my presentation, and it's been really great being in this program with all of you. Thanks. Bye.